Hi, this is Dr. Galitz. What I'd like to do is give you an example of lower face work and upper face work and kind of show you the difference of what the surgery does and what's the appropriate surgery for the particular problems. Here's a very good example of a young lady who had upper face problems. Now, she came in asking for a blepharoplasty, and at the time I said the better thing to do would be a temporal brow lift. And you can see here, and this is actual results. We did the temporal brow lift high up in the temple, and you can't see any incisions, and you see the wonderful improvement over her upper lids. The problem was not in her upper lids, the problem was the dropping of her brows. So once we solved that problem, it completely rejuvenated her upper face. She did not need any upper blepharoplasty work at all. Now, had this patient still had a problem in the upper eyes, we could have then done a blepharoplasty. But the most appropriate thing was to rejuvenate the upper face with a lateral temporal brow lift, which again hides in the brow and gets an absolutely beautiful result. You can see this did not affect the bottom of her face, which was not a problem for her. She didn't come in requesting any surgery regarding that, and we took beautiful care of her by just taking care of the upper part of her face. Now, here's a wholly different thing. This is a young lady who already had reasonably high brows. Now, as you can see on our imaging machine, we did a really nice job of removing her neck creases and lessening the nasolabial folds and getting rid of her jowls. This is all lower face work. Best way to look at it is all this takes place below the eyes. And this was done with a standard facelift, which includes doing neck work and it includes doing work in the front of the face. And you can see it's an absolutely beautiful result, looks perfectly natural, and this addresses the lower part of the face. Now, you certainly can do both things in one session if that's the case. Now, had this lady had drooping of her upper eyebrows or significant skin in her upper lids, we could have done the same procedure we did with this young lady and done the whole face at one time. However, this was a case where each lady needed something very specific. One needed upper face work, the other needed lower face work. And both of them got excellent results, and that really shows you what a wonderful change you can make doing these really nicely. So hopefully what I've done is showed you that there is a difference in the approach to the face. A facelift takes care of certain things, a brow lift takes care of certain things, blepharoplasty or eye surgery takes care of certain things. It's really important to address this problem specifically and do the surgery that's going to go ahead and best rejuvenate the area that's of concern to you. Thank you. This is Dr. Richard Galitz.